Hi, I'm Dr. Dave, and welcome to Taking Care of Your Pet. For the next couple of episodes, we're going to talk about a disease which dog owners hear about, and when they hear their dog or puppy has it, fear and doom overcome them. That disease is canine parvoviral enteritis. You often hear it shortened to parvovirus or simply Parvo. In actuality, the term parvovirus refers to a class of viruses with certain common characteristics. It is really the enteritis part that concerns us. Enteritis means inflammation of the small intestine. I'm hoping to shed some light on Parvo in the next couple of episodes, so let's begin by gaining an understanding of how your dog gets it and just what it is. The virus is transmitted first when a vulnerable dog ingests infected feces. The virus begins replicating in many of the organs which produce disease-fighting white cells and can actually suppress the production of those cells. It spreads to the small intestine via the bloodstream. The small intestine is lined with microscopic finger-like projections called villi, and I'll use my fingers as sort of an illustration. They look like your fingers. The villi aid in the absorption of important nutrients. The parvovirus establishes itself at the base of the villi-like, the webbed area between your fingers. Normally the cells which line the villi mature in these in-between areas. They're called crypts, and then they migrate up to the tips of the villi. As they migrate up towards the tips of the villi, they acquire their nutrient absorbing capabilities. The parvovirus infects this area and causes the collapse of these cells, and thus this important layer of the intestine is destroyed. Dogs with Parvo are unable to absorb any nutrients, and they have a difficult time retaining water as well. Because of the loss of this important layer of cells, infected animals are further prone to severe bacterial infection. Earlier we touched on the fact that the virus replicates in some of the organs that produce disease-fighting white blood cells. Here, the virus can destroy immature white blood cells, so they cannot aid in overcoming the replicating virus. All of this can add up to a serious systemic infection, and all too often, what we as pet owners know all too well, death. This is just a brief overview of how the disease works. In the next installment or two, we will talk about the care of infected dogs and how to best go about preventing infection in the first place. I'm Dr. Dave, and thanks for taking care of your pet.